The resident who has her own teeth is lying in bed and needs mouth care. The resident is not able to provide her own mouth care, and the role of the resident is played by a person. After completing beginning steps, the candidate will go in and raise the bed, and then raise the head of the bed using pillows to ensure that the resident is sitting 60 to 90 degrees upright. Next, she will ask and apply a clothing protector. She'll apply her gloves. She'll offer the resident a sip of water to wet her mouth. And keeping the cups separated, she will use the second cup of water to moisten the toothbrush. And apply the toothpaste before brushing the teeth. She will brush the top first, brushing the outside, the inside, and the biting surfaces of the teeth in a gentle motion. And she will offer the resident to rinse her mouth after brushing the top, providing the emesis basin for her to spit in as needed. She'll brush the bottom and the tongue. And leaving the area around her mouth clean and dry, she'll offer a wipe, another sip of water. Leaving the area around the resident mouth clean and dry when the care is completed. She'll remove the clothing protector, remove her gloves, lower the head of the bed, lowering the bed, next she'll apply her second set of gloves. She'll put the clothing protector in the hamper and remove the emesis basin to the commode. Rinsing it out and dumping that in the commode. She'll place a barrier on the sink, dry it out. Disinfect it if disinfecting is being used. Remove her gloves. And return the emesis basin to the nightstand. And complete her ending steps. A resident is sitting at an overbed table and the resident's denture is in the denture cup. The resident is not able to provide her own mouth care or denture care. The resident's denture needs to be cleaned at the sink and the resident needs mouth care. The denture is stored in the denture cup after cleaning, and the role of the resident is played by a person. She will put on her gloves to do the mouth care. At first, she will protect the resident's clothing before providing the mouth care and remove the protective cover when the care is completed. She will provide the mouth care, cleaning the upper and lower gums using a moistened foam tip applicator. She will offer the resident a cup of water to wet her mouth. Providing emesis basin for her to spit into. She will wet the swab. She will clean the upper and lower gums, including the tongue, the top with one swab and the bottom with a second one. Allowing her to rinse her mouth in between. She will offer a wipe to leave the area around the resident mouth clean and dry when the care is completed. And will complete the skill by removing the garbage to the garbage, the clothing protector to the laundry, and emptying the emesis basin into the commode, rinsing it out and dumping that into the commode, placing it on a barrier and drying it out, disinfecting if disinfecting is being used, removing her gloves, returning the emesis basin to the nightstand, the resident's dentures need to be cleaned and stored in a denture cup after cleaning. After applying gloves, she will run the water, warm or cool, and line the sink with paper towel to protect the denture from damage while cleaning. And she will be sure that when she holds the denture, she always holds it directly over the basin where the paper towel is. She will apply toothpaste to the denture brush on both sides. And remove the denture from the denture cup, holding it in the palm of her hand. She will brush the outside of the teeth, the inside of the teeth, and the flat biting surfaces, turning it over and using the narrow point of the brush to brush the ridge. She will rinse the denture and the toothbrush. And before placing the denture into the denture cup, she will change the water to clean water. Next, she will remove the paper towel from the sink. Remove her gloves. We'll take the denture cup to the nightstand, asking the resident if it's okay to put the dentures on the nightstand, and then complete her ending steps.